Hey everyone, welcome once again to Medical Practice Success Secrets. This is Theo Harvey. Today I have the honor of speaking to Brittaney Jenkins. Brittaney is a dedicated public health practitioner, speaker, and executive mentor with over 12 years experience in healthcare and public health. Thank you, Brittaney, for joining us today. How are you?
Thank you so much. I'm doing well. Thank you.
Great. So
my career in healthcare is what really led me to prevention, to public health. And when I was working in hospitals and rehabilitation centers, I noticed that patients were there for things that could have been prevented. And those are chronic diseases, right? And so for me to see these patients struggling and at a time in their lives where some of these patients were dealing with amputations, memory loss, so many different challenges, not being able to be with their families, losing their jobs. And so I changed my career to public health so that I can increase health literacy rates among adults and youth. And I think that definitely pours down to our children in our community when we are more informed about our health and make informed decisions about our health. Health literacy, health education, access to resources, looking at what those barriers are, right? Those social determinants of health. And as a health educator working for government agencies and medical centers, I've been able to help develop different programs that have improved health outcomes, improved health literacy, improved trust and rapport among health professionals and community, and so much more. But the chronic disease background that I've obtained, it just really hit home that these things are preventable, and creating programs and relationships within the organization and community is essential to overcoming some of those barriers.
No, that's very insightful. I think what we're seeing is obviously the importance of prevention and helping patients and chronic conditions. Unfortunately, they never go away, but you can manage them better and more effectively. So my company, we do a lot with diabetes management. We utilize continuous glucose monitors to help patients manage diabetes more effectively. And so we're seeing impact that way. But education is key, right? Understanding the importance of how to navigate diet and exercise to kind of manage that more effectively.
Absolutely. But when people hear like diet, exercise, healthy eating, they think of things that are boring, and it can just be some quick substitutes. Even they say getting out for 10 minutes a day, 30 minutes a day is all you really need. You don't have to be this gym rat in the gym for hours on end to live a healthier lifestyle. There's small changes you can make with your food, your environment, your habits. I love talking about tobacco cessation because that's also a risk factor for chronic disease onset. And changing up your routine is a huge thing as well. So what we do with what we know is also one of those things about taking action and accountability for our health.
That's a good point. My parents were smokers for a long time. And so to your point, there were certain triggers, right? Maybe after a meal, they would go smoke, or maybe they saw it as a social gathering. And so maneuvering and changing that behavior trigger, kind of say, okay, maybe I chew gum after I have a good meal instead of, smoking. And so that helped them alleviate some of the smoking habits that they started down the path of many, many years ago. You're right. Just those simple choices and just being consistent can help in changing behavior for the long term. I get that part. Doctor, he's saying, if you don't know Dr. Manley, he's saying he's doing a wonderful work out there on the internet about communicating the value of health, as well as helping you guide your patients through the journey of just taking care of themselves and explaining difficult topics around heart health.
I think the best way to answer that is with a patient that I just had. So I was seeing her for the past 3 months she was having abnormal heart palpitations, skip beats, and we couldn't figure it out. So I put her for a heart monitor for 7 days. I couldn't capture it. So I felt good that I was going to capture it in 30 days, still couldn't capture it. And I remembered that I have a device called a cardiomobile, which is basically an EKG that you have at home. It's about this big, and you put your fingers down on it, and it'll give you an EKG at that time. And I think within 2 months of her buying that, she was having the symptoms again. Thankfully, she was awake. And then we were able to find the abnormal heart rhythm that she had called SVT. From that, I was able to send her to one of my partners who does an ablation to basically potentially get rid of it permanently. So if it wasn't for her getting that cardiomobile, we probably would have never been able to diagnose what her symptoms, what her issues were. So it's pretty awesome that, in the past, to be able to get an EKG, you had to come to the hospital, they had to put all these electrodes on you. It was frustrating. They would leave some on you and you would find them when you were taking showers. But now at home, you can basically get your own EKG. You can actually save it and you can send it to your doctor, and they can make medical decisions based on that.
Yeah, we're seeing obviously the advent of artificial intelligence become more relevant. And so it's still early days, clinical decisions with it, but in certain cases, looking at data sets, radiology is being able to find things better than a radiologist, right? And so to your point, the data, capturing it at where the patient lives, and then being able to kind of utilize the data to find trends can really help be an assist to the doctor. So I could definitely see technology with artificial intelligence embedded, assisting you in making those decisions faster, right? And saying, hey, based on the data, because from my understanding, you guys do a lot of case study work in medical school, right? So your percentage of a 75-year-old man who has this type of condition, he's going to have X. Right, based on statistics, right? And so that's what artificial intelligence can do to kind of help accelerate that. So we're seeing more of that.
There's some softwares that are tracking your age, risk factors, and your EKG. And from that EKG, they can predict if you're going to have heart disease in the future.
Dr. Eugene Manley, how are you doing?
Hello, I'm good. Thanks for having me today.
Well, let's get into who you are and what you're about. So everyone, you don't know Dr. Eugene Manley Jr. He's an inspirational speaker, educator, and information magnet. The author speaks about STEM careers, navigating academia, workforce, and clinical trial diversity.
There have been some great campaigns that have been done recently. I think it was Intersect did a Save by the Scan campaign. I think there was also a National Lung Cancer Screening Day campaign. And there's a group in California. I've just drawn a blank on their name, but I think they had a website, Screening Saves Black Lives, or Black Screening Saves Lives. I'm so mad that I can't remember the name right now. But if social media is used effectively and you present the information factual, accurate, but from a community and you're trying to engage lens, it is more likely to be accepted than just throwing the pictures of the people coughing. And like, cause I see a COPD commercial and that triggers me, but maybe also because that group is a chronic asthmatic. And I was in the hospital 20 to 30 times a year just with my asthma. And so those commercials, I don't like them at all. I understand what you're trying to say, but there are other ways to get the message across. So a lot of times what we do in lung cancer, we also now try to make sure people know that while smoking is one of the leading risk factors, anyone with lungs can get lung cancer. So we have people that don't smoke. There are other risk factors like indoor cooking modules, living by freeways, chemical plant exposures, toxic air pollution. Just think of people that live by areas that have a lot of forest fires. Just think of all the particulate matter. So there are many other risk factors. And the other flip side of that is there could be a person that smokes every single day of their life and never get lung cancer. There are some people that only smoke once, and there are some people that just don't smoke at all. So you just never know. While it's a risk factor, you just do the best to try to minimize your exposure. But we know the campaigns in the 80s did a great job of getting people to stop smoking. But the downside was it used sometimes such demonizing, triggering language that now today people think that, oh, if you get lung cancer, you had to have been a person that smoked, and then you get demonized for this. And it's like, that's not the case.
I remember those, especially the drug ones, right? This is your brain on drug. Forget some of the more frightening ones. Oh yeah, they had that one about the smoking and the young lady had the hole in her throat. I think that was like, and that was like, wow, that was like powerful, right? And so it kind of changed the generation to kind of think of smoking, negatively. Obviously, my parents' generation, I think that was one of those things they just did to be cool. Now they started to kind of get away from that in the 80s and had those, like you said, really aggressive marketing techniques. Now we're in a different era, right? We don't be as aggressive, but more of that soft kind of influence when you see on social media. And to your point, get to know people, like people, and trust them, individuals who have similar backgrounds and things of that nature. And so having culturally relevant language that speaks to you and your kind and about what's important to you. Do you think influencers help at all, like social media influencers or celebrities, that impact behaviors when it comes to awareness or change behaviors?
I don't know if it so much can impact behavior, but I think when at least the famous people talk about that they were fighting a cancer, it humanizes it more. Now, some people may disregard them over their famous person talking, but if they are getting the awareness out about the disease, I think it's helpful. Influencers can and cannot help. It just depends on what they're trying to influence. And you can have a presence and reach without necessarily being an influencer. Like, I wouldn't say I'm an influencer, but my content just says how do we help people navigate disease, learn about STEM careers, learn about outcomes, where can you find resources? So, but you can use these voices to amplify what you're trying to do. I think that can be effective, but don't solely rely on that. I still grassroots community engagement, going to schools, going to churches, going to the farmers market, where people live, not just the same standard places.
Super excited today because I have a great guest, Dr. Rifai. He is a 30-year specialist in nephrology based out of Panama City, Florida. He's really focused on his global outreach, which he calls the virtual nephrologist. It's about creating common language to help with healthcare education for the common man, to help him guide in the complex nature of healthcare, especially around nephrology, chronic kidney disease. Dr. Rifai, how are you today?
Thank you. And yes, I'm doing fine. And greeting to all your listeners. And I'm excited and honored to be here on your show. So we're not officially trained to be actors. We're not officially trained to be speakers. We're not officially trained to be techno. But people who will see your eyes, will see your passion, will see your tone of language, will realize whether you're trying to sell them a product or you're trying to sincerely, genuinely give them a loving advice. You don't have to have complex and sophisticated devices and a production team. People will see that. My studio is a cell phone. And my editing team is my computer, and that's it. People see it. That's all what I have. But people see the passion, the sincerity. And that brings something very, very important. When somebody give an advice and at the end want to sell you a pill, a juice, a product, a course, you know the purpose of that video is to sell you something. And beware as a patient of any of those pills and concoctions and so forth that are labeled as reversal of kidney disease. There is no such thing. Unless it's an acute renal failure, unless it is an immunological disorder, which is in rare circumstances. But usually the chronic kidney disease is progressive, irreversible. So to my colleague, if you want to start, get started. It's very easy. We're smart. We're doctors. We can figure it out. But that's not the point. The point is, how sincere are you? If you're sincere, people immediately will see it, will be able to judge you very easily. On the other hand, if you say, okay, well, thank you very much. This is chronic kidney disease. But by the way, I have this product. Go to my website. Here's a link. Each pill is $49.99. And if you buy 10 of those, I'll give you a discount. Now you know this is not sincere. Whereas, please give yourself a birthday gift of going to the doctor, figure out whether you have kidney disease, and that is music to my heart. Then we'll say, you know what? This guy doesn't want anything from us. Maybe he wants to be sincere with us and tell us. The other thing is that make sure you maintain all the HIPAA and medical etiquettes. This is the world. Do not be lax regarding the privacy of others. Even if you don't mention names, people may know. Like, for example, if you're in a small town and you say, I'm not going to mention their name, but so-and-so hospital had a triplet. Everybody in town know because they know the triplet doesn't happen, and so forth. So it's maintain privacy, be sincere, choose what platform, and you will learn. The only way, I cannot teach you. You have to walk the path and fall here, trip there, learn this, what I would call, when my kids used to play video games, learn that cheat, learn that shortcut until you get to learn how to do it. So I cannot teach, but what I want to give you and tell you is remain sincere. People will see it. Even if you don't look as an actor or have the talent of an actor, but people without a doubt, 100% can judge sincerity. So be sincere and get the message to help humanity.
comes from a genuine place and people can sense that. You don't have to speak super well, have high production values if it's coming from a genuine place and also from a place of expertise, right? To your point, we see so many influencers out there. We had a recent pandemic. We had so many people come out of woodwork who were experts, right? and respiratory disease and all this stuff. And you're like, wait a minute, did you go to school? Do you understand the rigors of science? Understand what these white papers and literature is really speaking on? And then to your point, then you come to find out they're selling something. And so what you're selling is knowledge, expertise, but more importantly, the power back, giving people power back to take control of their own health. And like you said, you can slow down the progression of some of these diseases that you don't even know you had. And so I think that's where people can kind of get the results that they're looking for and going from that intention. I always say sometimes it's hard to know who to trust in this world, and all that. And I have this mnemonic, if you'd like me to share it with you real quick. I call it HIT. So if someone is talking to you and you want to see if you can trust them, do this HIT thing. H stands for what's their history, right? What's their background? Like, did you go to school to be a doctor, right? They're talking about, what the things you should take and all that, but look at their background. You easily can search that online. I is basically intention. Like, what's their intention? Like, are they trying to sell you something? Or are they coming from a genuine place? And T is legitimate talent. Are they talented at this thing? Do they practice being a doctor consistently? And so if you kind of, use that mnemonic, that helps me kind of guide what sources I should trust, right? Instead of just following by.
I love that. I love that. I learned a lot. I love that. That is actually applies to everything.
Exactly.
Applies to everything, whether you're selling healthcare, whether you're selling, like, for example, I cannot be a spokesperson for hair products. But, and I cannot say, because, I may be a doctor and I may be sincere, but it's just my experience and outcome is poor. But, it's just amazing to see how, like you said, during that time, a lot of people came in with expertise. And that brings a very, very interesting subject. During that time of the pandemic, I was working in the ICU and I've seen it firsthand. So I was seeing those patients. And I realized that one of the best things to do for the pneumonia is to lay down on your stomach, on your hand and knees, and cough to get all those secretions out. So one day I used my sophisticated studio, which is my handheld camera. And the studio is actually the walkway or the driveway of my house, just regular concrete with grass. And I recorded a video on how you should position yourself so you can do chest percussions so you can get the secretions out. I made that video, did not want to sell anything. There was no product to sell. There's no advice. There's no booklet, nothing. And that video has circulated the world so many times, translated to 7 languages. People started using it and people started to send it to their relatives and said, you have a doctor here in Panama City. And all what I wanted to do is I wanted to show people sincerely how to position themselves to cough, to get rid of that COVID pneumonia. And that was one of the reasons why I learned how sincerity. I did not look like I had any training. The video quality is not the best, but actually it made a difference for people.
No, that's a wonderful story. And so, all the physicians that listen to this podcast are just trying to understand, just start with sincerity. You're already answering questions to your patients now, right? A lot of doctors probably got burnt out during that process and feel like that nothing can change, or they feel overwhelmed about all the changes in healthcare, right? With administration and ways of getting paid and compensated. This is one thing a doctor, I think, or a person who owns a medical practice can take control back, giving your expertise out for free. And you'll be surprised I'm sure on your side, you have seen a bunch of opportunities where people come back to you and communicate and give you, so much more to your life because you have that intention and of giving back to everyone else. So commend you, Dr. Rifai, and what you're doing and how you're kind of helping patients in this space. With me today is Dr. Clarke. She is a board-certified family physician and volunteer adjunct clinical instructor of medical education for the Keck School of Medicine at USC. Dr. Clarke, thank you for joining us today.
Thank you. Thank you so much for having me, Mr. Harvey. I appreciate it. The AI Scribe is actually something very helpful and very useful for me personally. It saves a lot of time. It's very secure, and it's just it saves a lot of time because it takes me a while just to formulate the documentation for patients. So it takes away that burden because I don't want to look at patient as another note. That's how I see it. When I start looking at this patient as another documentation, that's when I know I'm really like on that burnt out spectrum of things. But that definitely helps with time. The thing is, I feel like there should be some regulation in regards to how much communication they have with us in a sense. I don't want to have a dialogue back and forth when it could be a visit we need to talk about. You know what I mean? So there should be some limits to a certain extent in regards to you can't give me all your symptoms and your issues and expect me back and forth through the email or through the portal to handle the issue. You know what I mean? Like, and I do believe there are some positive things that came from the pandemic in regards to the telehealth and telemedicine being available so that patients don't have to come in. But you cannot do everything over the phone or on a video. Like I can't do pap smears. I cannot evaluate your shoulder situation through the phone or through the video. So
No.
these things can be helpful if I just need to tell you results. And like sometimes patients want to come in to follow up with me when I say, oh, I could just call you. Oh, I want to come in. No. So I will say you only need to come in if like I saw something wrong with your blood pressure or, you know, we're dealing with a new thing. I want to physically examine to see that it's resolved. But if I'm just telling you your results or I'm just calling you to see how you responded on your benign prostatic hyperplasia medicine so that you're not peeing all night, I don't necessarily have to see you. You know, so they don't always know when it's appropriate for those, you know, technologies that involve the computer and not human touch. On the other hand, it is helpful. So it just depends on what it is. So to summarize my response, I think the AI scribe for sure is helpful for me and for writing letters. Like people, oh, I want a note for this. I want a note for that. That's very helpful for those things because you can put in.
And you hit the nail on the head. I mean, the whole thing about physicians. I saw a statistic by the American Medical Association. They said physicians have received 57% more text messages since the pandemic. So prior to the pandemic, you know, it wasn't as useful, but now I guess patients are used to kind of talking to a doctor via text. And doctors, as honest, are used to probably responding that way, right? Prior to the pandemic, when I reached out to doctors and talked to them, you know, it was either phone call or in person. Now, you know, how many times I text doctors back and forth to kind of have communications. So to your point, we're seeing ways to kind of use technology, kind of triage that a little bit better. And that doesn't have to necessarily go for you, especially if it's a question about billing, or if it's a question about medication, there's things like that, refills, that can be kind of triaged and sent down the traditional path, kind of like with your calling trees, right? When patients call the doctor's office, right? Call one if you want to speak to billing, call two if you need a refill. And to your point, there has to be a standard way of care. Annual wellness visits are great, you know, so that you can kind of have them at one time and kind of have a conversation with them and basically kind of set that care plan together. But again, the time factor, right? You know, how much time you have to kind of see them and really go into depth with their help. I think that's going to be key. And I think technology has a place as with everything. And to your point, it just has to be useful and doesn't put more burden. Like, unfortunately, you see statistics about EMRs. Yes, they're great with digitizing records and getting data, understanding. But to your point, doctors became more transcribers, right? Putting data into boxes. And that wasn't great for customer care. So now we're creating technology to help us with a different technology that we needed. So, so anyway, so to your point, I think it has to be useful. What we do chronic condition management. So we kind of use like blood pressure cuffs and scales. They're cellular enabled so patients can use them. So for like cardiologists or even primary care is really worried about uncontrollable hypertension or diabetics, you can get that data automatically pulled in. You can send trending information. So that can help. You're not getting a lot of alerts and alarms for unnecessary stuff, but stuff that's trending and you want to check how certain medications are doing with patients is really helpful for that. And so, you know, really
I definitely agree with that. I mean, I say the patients are at home where they are more than they are with me, right? So those values are definitely helpful, you know, because, you know, they call it the white coat hypertension when they get in the office and their blood pressure is high because they're nervous and scared. But so when they say that, I don't give them a pass to say, oh, they don't need medicine or they don't need to manage it. Because I do have blood pressure monitors that I do distribute to patients at my clinic. And I say, check your blood pressure. I'm going to follow up with you or have someone else follow up with you in about 2 or 3 weeks. And I want you to tell me what your readings have been looking like. And I also give them the range or the value to know what is normal or not normal. So they can't get away with telling me, oh, it was good or bad. What is good? Like, what is bad, right? We need concrete information and data because you could think good is, you know, 170 over 80. And that's because you're used to being 200, right? But that's still not good. Okay, it's better, but it's not good. So I really like to educate patients so they're aware what we're monitoring, because I feel like when they know what's going on, it makes them more involved, it makes them more mindful in care and more compliant with the whole program.